Okay, so I would check my doctor's orders. I would want to know if it's going to be an indwelling catheter or a Foley. I would also see what size. Okay, and then I would knock. Would introduce myself. I'm Rhiannon and I'm a student nurse with Highland Community College. I need to ask your family to please step out. I would have them step out, close the door, give privacy, and then I would say, do you know why you're getting a catheter? And if they say no, today patient's getting a catheter because she's going to have surgery and we want to monitor your output and to make sure that you stay dry for the surgery. Might as well while we're on that subject. 3 potential indications that someone would need a Foley catheter would be like acute urinary retention, surgery, and end-of-life care. Risk factor though with the Foleys, of course, are urinary tract infections. The signs and symptoms can vary. We can have anywhere from mental confusion, fever, chills. You could tell by the urine, the output. Does it have a foul odor? Do you see any blood in it? The consistency, and maybe they're just not having output. So now that I've verified the doctor's orders, I've introduced myself. Okay, so now I'm gonna wash my hands, do peri-care. So I'll just go through it. Raise the bed. And we'll put gloves on. Peri-care. Okay. I would put the bed back down, cover the patient back up, and I'm going to gather my supplies and I'll be right back. So then I would step out. I would do good hand hygiene. And I would bring my supplies. Okay, and at this point I would ask for a partner. Being that she is a female, I would have my partner have a flashlight so she could hold up so I could see. She could also help me position the patient. There we go. Okay. So then I have my tray table. It's been sanitized. I'm going to open it. Of course, I would have a blanket draped. I would have my legs covered. Privacy. Okay, and then I would just drop it. I don't want anything to go past my waist because otherwise it would be contaminated. Okay, I'm going to open it away from me, and there is an inch border that I am allowed to touch, and my field will be sterile. I am allowed to move it. I do not want my sterile field touching the patient. I'm going to grab Okay. Hand sanitizer. I'm going to take my gloves out. Okay, and I want to be careful not to touch the inside of the package or the outside of the glove. Okay. And then I can touch anywhere on here because I am sterile. I will tuck my thumb in so I do not touch the outside with my other thumb. I will leave it. I am going to use a sterile field. Okay, and I'm going to be careful not to touch anything with my gloves. My sterile field is down. I will not use this. I will drop it into the garbage. Oh, I didn't grab a... Shoot. I gotta start all the way over.